Me and my husband had went to our fall family day at Toyota, and I was already late on going to have my mammogram done, and we seen the mobile there, so we just decided that I'd go ahead and get it done since I was late. We took it, and I asked how long before the results would come in, and they told me it would take a little while, not long. Whenever they did get a hold of me, I got my results, and they were positive.
Well, in October of 2016, I was getting a routine mammogram, and I almost canceled that day. I was running late, and they encouraged me to come on in and have it. And within an hour or so, I was called by one of the girls and asking me to come back on Monday to repeat the mammogram. So I went back on Monday. My husband accompanied me. I had another mammogram, and then I had an ultrasound, and Dr. Johnson came in and said he wanted to do a biopsy, and it turned out to be stage 1 breast cancer. So that was the beginning, and it was terrifying.
So I went in for my appointment. I've never had anything different happen. That one was different. Something just didn't feel right about it, and they had said they wanted me to come back because they needed to look at it at a different angle. And then 2 days later, it was July 7th, 2017, I got the call that said, "You have cancer."
So I had the diagnosis on October 10th, 2016, and Terry arranged for me to have the MRI just a week later on Monday the 17th. And then she had me come to the interdisciplinary team that Friday, I think it was the 21st. Terry took me by my hand and let me know everything that was going on. It was good to have a nurse navigator because I could always talk to her. So within diagnosis to the IDT, it was only 11 days. And I met with Dr. Schumann and Dr. Braden and Dr. Taylor, and also the genetics lady.
We all know that breast cancer care is complex. It involves surgeons, medical oncologists, radiation oncologists. There's a radiologist that reads the images, a pathologist that looks at the slides. It involves sometimes reconstruction and plastic surgeons. It involves genetic counselors so that they can look at the family history of the patient and see if there's a need for genetic testing. So this complexity of care is what sometimes lead to treatment delays or patient dissatisfaction. It can lead to duplicate testing. It might lead to errors. By bringing all the providers that are involved in the care of the patient, we have real-time communication, face-to-face, with all the parties that are involved in the care of the patient. We are able as a group to have a plan that is a higher level, more intelligent, better quality type of plan instead of having a sequential approach, which is the traditional approach.
Whenever I had the appointments all set up in one day, that was very convenient. Me and my husband were both able to be here. You didn't have to come back. You could be here all at one time. And they were very helpful in telling us if we didn't understand something, they would explain it again.
It was definitely reassuring, not having to go around town, calling places, making appointments, getting off work, just to make these appointments. And I had it done in one day. They were on it. They, were like, if it's in your lymph nodes, you have to have this. If it comes back in your genes, you have to have this. And I didn't have to go anywhere. They came to me.
By condensing the process into one visit, you will minimize the amount of time between diagnosis and the start of treatment. Studies have shown if you delay the treatment from diagnosis by 3 months or more, the risk of having metastatic disease might increase by about 10%. So the sooner we can do things, the better it is.